than what I'm going to teach you, but I'm just trying to work out what's the best way forward. Okay? And the whole idea is that the clinical part is based upon the basic part. And if you remember the concept, it will be very easy for you to understand. And today's lecture actually is one of the things that is going to help you as a pharmacist, because one of the things that you will come across is allergy. That's what I'm talking about right now, allergy. You have to understand what is allergy more than a layman. They all understand, and you have allergic reaction, allergy, all these things. Okay. So today and tomorrow we're going to talk about the allergy. In terms of immunology, it's called hypersensitivity. You can see, right? So if you go back and remember that immune system is there to help you, to respond, to defend you from any oncoming danger that the immune system sees foreign. So one of the things that immune system is going to do is going to react. And remember, I told you it has to be a balance out. Sometimes it overreacts, sometimes it underreacts. So in today's case, it is going to react and overreaction. This is like hypertension. You have to have a tension in the heart to pump and tension in the arteries to take the pulse, but it is a hyper more than required. So this one is hypersensitivity. So far so good? Okay, so let's start the concept. So there are 4 types of hypersensitivity reactions, 1, 2, 3, 4. 1 is a little bit difficult to understand, 2 or 3 pretty much is the same, 4 is a little bit different. Okay. So in this case, keep that in mind from, if you go back to your recall memory, the very first thing that happens in hypersensitivity, one reaction is that your body gets sensitized, right? Or in other words, it gets exposure, right? And the other way to put this is that it gets exposure to a particular antigen or a particular allergen or a particular immunogen. If you remember, I said that all immunogens are antigens, but not all antigens are immunogens. So those immunogens that have immune response may be allergens, specific allergic response. So now you see this antigen your body sees it for the first time, so it behaves differently. Okay. So keep that in mind that we divide that into 3 steps. First one is sensitization. The second one is activation, the whole immune response. And the third one is effector phase that now is going to react. And this is important in terms of our treatment as well. Because if you understand this concept, you understand how to deal with allergies as a pharmacist, as a physician. Okay? Now, some of the points are taken from my lecture. And if you remember, the PowerPoint lectures are kind of brief talking points for you to help you read the material. So I would still encourage you to read the material, and if you want to go and listen to me over and over again, the lectures are recorded and they're posted on YouTube. Okay? So the antigen, if you remember the whole concept that we discussed, can you give me like a marker that works? Which color works? Which one?
They should, yeah.
Yeah, all those in here should work.
All work. Okay. So keep that in mind that we already discussed, the antigen enters. Now this has to enter. There's only 2 ways for this to enter, either through mucosa or through skin. So it enters over here, and then it is taken up by antigen presenting cell. Same old story, right? And this antigen is going to be broken up, put up on a receptor which is MHC, right? Over here, and then presented to cells, right? In this case, especially T cells, and then the T cells respond, which is called, what is it called? effector response. So that's pretty much the game in a bigger picture. Right? And we already discussed what are the responses of T cells. So we are talking about this one, sensitization phase, this one. Your body gets exposure. And then this activation phase, and then effector phase. So basically, this one is 1, 2, 3. Pretty much the same, correct? You agree? Okay. Now in the bigger picture, if you keep in mind that where are these antigens coming from? So these antigens, specific in these antigens, if you're going to get an allergic response, they are also called allergens. Allergens, they are an allergy. And one of the things that keep in mind in the whole story that we're going to discuss is IgE, an antibody response, IgE. And you also remember that they were produced in small quantities, but if the level of IgE goes up, then there's something going on, your body is fighting with that. Now these allergens, it says over here, 50% of these, especially the IgBT, are airborne. So probably we pick it up from the airborne, and it can go to the mucosa of eyes, nose, lungs, right, skin. And this is the first exposure that we get these antigens in the air, right, and get exposed to it. So that antigen is going and hitting our eyes, nose, throat, lungs, and generally the skin. So that's where the allergens are coming up. Now keep that in mind as a rule. First time exposure to an allergen or antigen does not have a strong effector response. But that's a rule. It has to be repeated exposure or second time exposure. I'm going to discuss that how. So that's another important thing you have to keep in mind. Okay. Now, this is what it is. So it has to be a repeated exposure. That's that. It has to be repeated exposure, okay? And most of the time, these allergens especially can be plant pollen, mold spore, house dust mite, animal dander. That's most commonly we and you are exposed to. So if you see the real-time patients, they come to you and they have problem. So either they have plant pollen, so especially it's going to happen when time it's pollinating, or they are going to be in houses or area or dwellings with the mold, or house dust mites, carpet, unclean environment, or animal dander. They may have pets and they are not properly maintained. These are very common. Not that the others are not, they are very common in US. So you have to take a careful history and find out, where is it coming from, okay? Because keep that in mind, we are going to discuss in terms of treatment as well. So far so good? And 20% of the clinical symptoms that you see are allergic rhinitis. Remember I told you the other day that at Loyola University they put allergy department with the ENT department, because people most of the time who have running nose, coughing, sneezing, allergic, so he says I'm allergic. So nose takes the bigger brunt, especially if it's coming from the air. So allergic rhinitis, or running nose, running eyes, right? Coughing, so your immune response, body is responding. So that comes from that. It's also called hay fever. Hay fever is a term that we normally see. Now keep that in mind that we're going to discuss what happens in this case, and I'll discuss that over there as well, is that when the cells are exposed, it could be T cells and the B cells. And remember, T cells have a series of their effector functions, and B cells have their series of effector functions. And what is the biggest effector response of the T cell? Production of antibodies. There is the biggest response of the T cell. So in order for those allergens all the way over here, they produce antibodies. What we figure out that these antibodies are IgE. So these antibodies are IgE. Okay. And also keep in mind that when the T cell, one of the responses of the T cell response is it produces cytokines. And if you remember, there are two types of cytokines, Th1 and Th2. Th1 are pro-inflammatory and Th2 are anti-inflammatory, right? So in this case, what we noticed was, for some good reason, this whole thing produces Th2 cytokines, which is an anti-inflammatory. And then again, IL-4, specifically IL-13. Okay. So if you were to look at a profile, if you want to run a profile of a person who is having allergies, so since they produce IL-4, so you will see they have a very high level of IL-4. So this can be used as a test. So if I test you that you have this capability of vulnerability or predisposition to allergy, I look at your IL-4. So you say, I'm kind of a person who's very prone to allergies. How do I test that? I look at IL-4 level. Because you have 10 times more than normal people. And all these are important because we are going to design drugs to combat that. Okay? The other important thing in this key player, when we say cells, so other than this T cells, there are other cell lines which are also important, and the most important cell in allergy is called mast cells. You remember when we do two types of lymphocytic cells and hematopoietic cells, some of the cells are mononuclear cells, we have one nucleus, and one such cells you have to remember, it's called mast cell. This is how it looks like. It's a mast cell, it's a big monocyte-like nucleus, right? And it has so many granules. You can see tons of, I would say it is like a pharmacy of its own. I usually say pharmacy of its own. It's like go to the pharmacy and you have tons of drugs over there. So this is a pharmacy of the body. So it produces and keeps all these drugs stored, ready to go. It's like a pharmacy. You enter the pharmacy, you have prescription drugs, and you have over-the-counter drugs. Mast cell is full with that, naturally. Okay? But the question is that this mast cell is tightly secured because you don't want them to be given to, it's like prescription drugs and over-the-counter, people can get over-the-counter drug, but those drugs which not have very much severe reactions, or they can be tolerable or can be given in the hands of a lay people, but some of the drugs like injectables and other, they are tightly monitored. You just want to run, who's it for, we have a system. So in that case, we have a very secure mast cell because if you're going to trigger this release of anything that triggers release of all these chemicals over here, contents go out, they are going to cause a big effector response. Effector response, a very strong and profound effector response. And we'll have an issue to control it. Most of the time what you see allergy is because it's been, we call it, the process we call, this is granules, and we call, if you release these granules, we call degranulation. So we call degranulation of mast cell. So this means that they degranulate and they release tons of mediators, right? And that's what you see in terms of your response, running this and running that. Okay? So other than mast cell, there is another cell, which is also called basophils. There's another same kind of cell, X-like mast cell. Right? Now you have to keep in mind, how do you open this mast cell to release? So what's the key? I'm just giving you like an analogy. What's the key for that? What happens is that these cells, including mast basophil, they have a receptor which is a strong receptor, we call Fc receptor, which is like, if you remember the antibody, we have Fab, antigen binding, and we have this Fc receptor, right? It has a strong binding for this one over here for IgE. So IgE is a key to the lock of granule cells because it wants to attach to that with its leg, which is like Fc portion. So very important discovery. So far so good? You can stop me if there's any questions that you may have. So this is what happens in the first phase. Now in activation phase, if you come over here, so what normally happens is that we already talked about, antigen coming into the cell. It is picked up at antigen. It's presented to the antigen, presenting cells and then presented. In this case, what normally happens is that it shows over here in activation phase that it has the IgE which is produced from there is a key, and IgE has this, you see this like receptor, you can see this is a receptors for IgE. It kind of opens the key, IgE. So these are like all those locks which can be opened, and when you open up, so you got all these degranulation. So you can see all those mediators are released. Right? So you say mast cell degranulation, right? And it only happens when there is a key which opens up, and this receptor is called Fc epsilon R1. So this is a very specific receptor, and why do we need to know that? Because we have to develop drugs. Fc is a portion of the leg portion of the antibody, and so what we found out that, example, it's a induction of mast cell. We want to find out how the mast cell degranulates to cause problem, because we need to stop that. Okay. And what's the market? What's the best allergy medicine available on the pharmacy? It's usually kept on lock. Zyrtec. What else?
Claritin.
Say it again?
Claritin.
Claritin. So Claritin, what it is? It is a mast cell stabilizer. So this means that it will block over here, Claritin. Right? So Claritin is a drug that we develop so that they don't degranulate and the problem allergy is not happening. So you can imagine we need to know where this drug is acting and why is it acting, right? So it is, if you write in Google, you see Claritin is a mast cell stabilizer. See, it doesn't want mast cell to release. So far so good?
I have a question. So when you're talking about degranulation, that's when those start running and stuff like that?
It releases chemicals. One of these chemicals is a protein. Yeah. Okay, what we found out that there are more than one ways. One way, where is B?
B's right there.
Which one?
Right.
Where it says leptin?
This one?
Yeah.
So this is B2, right? And this is C3, and this is 4 probably, right? Okay. So these are, we found out 4 possible ways of the mast cell degranulation, right? But we want to stop that. So that's what the drugs are coming over here, Z-Tac and so on and so forth. So what we found out that since it has these gates for Fc epsilon R1, right? And what we found out that, and this IgE antibody comes and sits on top of those gates, right? So they need to be cross-linked. What we found out that they need to be cross-linked. It's just like an example of, just like, what example should I give it to you? It's just like, let's see. It's just like this guy over here, right? So it has to be cross-linked. There will be two. You can't do it one. So it has to, the whole system has to be cross-linked electrically to get the induction. So what we found out is that even if this Ig attaches to this one, it's not going to cause release of granule unless they are cross-linked. So it's like electrical activity. We call cross-linking, right? So what we found out, so you have to have another antibody against an antibody. So antibody against an antibody, which is called anti-IgE antibody, which is going to identify these and cross-link. So this is one way of cross-linking. Right? The antibody is a protein, and you can make an antibody against an antibody. So that's number one. Number two, we found out that the same concept is that you can use a lectin, and lectin is going to touch base with both of them and then cross-link. The same event will happen. Number three is that you can have another chemical, for example, the chemical in the drugs. You make some drugs, and this drug has a chemical that is going to attach to these two receptors and cause chemical cross-linking. Okay. So this means the drugs, lectins can cause a cross-linking and open the gate, right? And the fourth important thing is that you can also have a receptor. So this is a protein, Fc epsilon R1 protein, and if the antibody is made against this protein over here, this can also cross-link that. So antibody against this receptor. Because the idea is to cross-link them. So 4 ways, and why do we need to know that? Because we need to stop that happening. One of the things we found out that, as you can see from here, the whole process of activation phase begins when a mast cell releases granules, which are intracellular gate, releases that. And at least 2 receptors are bridged for this thing to open up, right? And then again, we have to have multivalent antigen that can bind to IgE. So we can have antigen which has a lot of valencies, the complexity of that, right? And then again, the physiological reaction of this release of chemicals to cause problem depends upon the dose and route. So if it's on the skin, it's different. It's like you give a intramuscular injection, reaction will be different. If you give a oral perforation, if you give IV, so reaction will be very fast. It depends upon dose of antigen, it depends upon the route antigen as well, right? And then again, these mast cells, right, they usually are present, you can see from here, it says in this picture over here, these mast cells, let's see, they are present in connective tissue, blood vessels, in connective tissue, lining of the gut and lungs. So if the antigen goes and binds them, because they're sitting over there, right? So this is important. In the blood vessels, they are sitting over here, and they can release that. Okay? And let's go over here. And once they release tons of chemical, anaphylatoxins. They can receive codeine, morphine, iodinate, so these are the things that usually cause reactions among the drugs. This is like among the drugs that cause reaction. Lectins are present in strawberries, and then again, they can go and act and cause the problem once they are released. But you have to have the mechanism in your mind that this is how it causes, and then you also have to keep in mind how do we prevent that. So far so good? Are you with me? Aaron? You with me? Okay. Now, we are here at the mast cells effector response. So now the effector response is here. So what happens is that now, this is a mast cell, which I told you are filled with that. It has this Fc epsilon R1 receptor, where this IgE antibody, it's an IgE antibody, which binds with there, right? And what we noticed was that in the whole process of this signaling pathway, calcium is also important, because calcium is a second messenger. Okay. Now what happens is, what we found out that this mast cell, when you look at what it is made, we found out that it has two types of, one of them are the preformed mediators. Some of the mediators are already there in these granules. We call preformed mediators, right? And examples of preformed mediators are histamine, heparin, proteases, ECFA, IL-8, and other cytokines. So they are preformed mediators, which are already there. That's why the commonest drug given in allergy is what? Antihistamine. Because histamine is going to cause the major reaction. So antihistamines, but others are also important. Okay? Sometimes what happens is that the signal goes over here, right? And this goes to another pathway. So there is a pathway of inflammation, you can see from here, inflammatory pathway where phospholipase creates activated phospholipase, is converted to activated phospholipase, and then it goes to arachidonic acid from membrane lipids. So it's like a signaling pathway that happens over here. In biochemistry, you must have heard and must have seen, which is called, and this is like the basis of the inflammatory drugs, which is called arachidonic pathway. So you can see arachidonic, and then it's going to go into these two important pathways of inflammation. So it is like inflammatory pathways. So it's going to release preformed mediators, right? And either they're going to cyclooxygenase pathway where the prostaglandins are released, or it's going to go lipooxygenase where leukotrienes. One of the other important drugs that are given for especially asthma. Asthma is also allergy, right? So it is to block these leukotrienes, which are cytokines. So the drugs which are there, kind of, we'll discuss this tomorrow because there's a second half of that picture which we didn't draw. But keep in mind the preformed mediators, and then again some of the other forms are over here, newly formed mediators. So you can see, you can give that uniform. And then there's a leukotriene, thromboxanes, prostaglandins, platelet activator factor, tons of things which are there. So in this case, in the preformed mediators, as we saw over here, histamine, serotonin, and chemokine factors and heparin, but we usually target histamine. And then you talk about the histamine, antihistaminic drug, they act on the receptor, drowsiness, and so that's like the typical, the common Benadryl kind of treatment, which is cheap. But this doesn't explain. But because it only targets preformed, it's not going to target other one. Sometimes what happens is that it makes late phase reactant. So the whole concept of this allergen leading to IG sends a message. You say, just like go to the pharmacy, we have this thing available, but this thing we have to kind of prepare. So it's going to take an order. We're going to prepare that, which is going to compounding it. So they're going to compound that, which are late phase reactant, de novo synthesis. So you can see from here the real treatment of allergy. And when I say allergy, you can give an example. You can take an example of asthma, allergic asthma. Right? So all these are treatments of allergic asthma, right? That makes sense? So before going into details, we'll discuss tomorrow about the treatment factor, but this is like the whole concept of, if I was to ask you, for example, if you were to design a drug for allergy or treatment for allergy based upon sensitization, based upon activation, based upon effector response, what would you do? Number one, if everything is caused by allergen, you say avoid the allergen. Stop the evil in the bud. You say, this has to be avoided. Plant pollen mold gets rid of that allergen, because that's a primary prevention, which we do. Okay? So that's primary. The second line of prevention is that we have to look at, for example, in this case, IgE, which is IgE comes over here for antigen presentation. But there's less we can do over here, right? Because it's a little bit complicated. So the next step, what we'll do is that, okay, IgE is produced, we can't help it. So we have to make sure that we don't let this mast cell or basophil act to degranulate. So the second line of drugs that we'll have is don't let mast cells degranulate. So we are going to come up with some drugs which are called mast cell stabilizer, like cromolyn. You give an example for claritin. That's a good line of drug, because this is going to save. But then again, there may be some other mechanism as well. So we can stop that happening. Okay, we can't do that, right? So then we will go and work up, like for example, fight against preformed mediators. What does anybody ever take care of an asthmatic patient? So you can go for the symptomatic treatment, is that because of the effector response, there's too much histamine or too much vasoconstriction in the blood, right? In the lungs, so you have to asthma, you have to give bronchodilators. So that's the effector treatment phase. But the idea is that we don't let that happen. That's the point. So that's why we have to develop all those drugs which are there in terms of the treatment of allergies per se, and the treatment, and it can go to a very rough form of allergy like running eyes, running nose, coughing to death, right? Because it can release all those mediators, right? And which can vasodilate the whole system, and you have a fall in the blood pressure, and the patient is gone. So you can see it depends upon the system of the allergic response. People of all the 4 types of allergic response, 1, 2, 3, 4, number 1 is the most severe form. I'm going to tell it in 5 minutes.
No, I'm just
okay. So hypersensitivity 1, hypersensitivity 2, hypersensitivity 3 and 4. Number 1 is the most severe form because you got anaphylactic shock. That happens because of hypersensitivity 1, where people can pass out. 2 or 3 are a little bit mild, 4 is a little bit mild, but it is serious. So it can happen because of the drugs, right? It can happen because of the lectin. It can happen with this antibody short circuit, but it's very serious, right? And then again, we have to come up with a treatment. Somebody said, okay, well, I can't get rid of that. Chicago is a bad place. I'm not going to get rid of Chicago thing. I'm going to stay over here. Then we say, okay, we'll have to come up with an alternative for you. Okay, so the idea in this case is we have to give you a treatment because maybe you are genetically prone to making too much IgE. Right? You are genetically prone to making too much IL-4. So then we have to work on these things. So treatment varies. We're going to look at the whole sequence. IgE, first player, IL-4, second player, IL-13, third player, mast cell, fourth player. It's like upstream. To the final, there is tons of things, all the way causing to inflammation, preformed. You can imagine if you got serotonin or other heparin, all these flowing in your system. That's what is happening. And then you have all these cytokines, you have all this late phase reaction, and then you have new deformity. So what we noticed was that giving inhaler is not enough, because the mast cell has many things which are released. Okay? So this is the first lecture, and we're going to continue with the treatment part. I would encourage you to read what I've said, so it will be easier for you. I'm going to teach you hypersensitivity 1, and then 2 and 3 together, and 4 differently, because hypersensitivity 1 is a little bit more complicated because it causes death by anaphylaxis, right, shock. But if you understand that, it's going to help you to understand being in pharmacy and taking care of drugs. Any questions? Okay.